All right, let's talk about dopamine. This is one of the coolest drugs that you're going to be given in the pre-hospital setting, just because it's so tailorable to the patient and the patient condition, and it's got multiple uses. So the indications that you're generally going to be using dopamine for: hypotension refractory to volume replacement. What that means is hypotension that you cannot correct with volume replacement with an isotonic crystalloid, normal saline, lactated ringers. Despite your volume replacement, if that patient remains hypotensive, you are going to be considering a vasopressor dose of dopamine. Examples of that would be anaphylaxis, sepsis. In extreme cases, it might be considered in hemorrhagic hypovolemia, hypovolemic shock. These patients that might be hypotensive despite putting 1.5, 2 liters into them. You want to get some squeeze on them. Cardiogenic shock. Remember, cardiogenic shock is indicated by a failing heart muscle with hypotension. So you need that heart muscle to squeeze harder, squeeze faster, and you need to provide some vasopressor effect as well. And also bradycardia. So as I'll go over the dosages right here, we can provide a dose of dopamine that's going to speed up the heart and make it squeeze harder. So mechanism of action, these dopamine will affect different receptors based on the dose. So the first bullet point there, renal and mesenteric artery vasodilation. This is less than 5 micrograms per kilogram per minute. You're never going to use this dose. So if you're given less than 5 mics per kilo per minute, you are misdosing, and there's really no therapeutic effect for emergency providers. When you get into that 5 to 10 mics per kilo per minute, that causes increased heart rate and contractility. So positive chronotropy and positive chronotropy and positive inotropy. So faster heart rate, greater squeeze. When you get into that 10 to 20 mics per kilo per minute, that's when you get the vasoconstriction dose. So you're actually going to squeeze those blood vessels. Now, let's talk about when you are actually going to be doing this. So this is going to be dopamine on your 5 to 10 micrograms per kilogram per minute. Now, bradycardia. So this is for patients that you're going to learn about in cardiology, but these are for patients that might have a heart rate of 30, 40, and they're hemodynamically stable because of that. ACLS and the American Heart Association say that you have 3 options that are all equal in order to speed that patient's heart rate up. One is external pacing, one is an epinephrine infusion, and the other is dopamine. And this is the dose that you would be giving to increase somebody's heart rate, 5 to 10 mics per kilo per minute. When you get into your cardiogenic shock, this is going to be at the higher end of your 5 to 10 mics per kilo per minute. You are going to be looking at probably the 10 mics per kilo per minute. The reason being is because you want to get the heart rate, the squeeze, and some vasoconstriction, okay? So this will be at the upper end around the 10 micrograms per kilogram per minute, okay? These are the 2 main medical emergencies that you're going to be giving within this 5 to 10 mics per kilo per minute. All right, now let's talk about your 10 to 20 micrograms per kilogram per minute. This is going to be your vasoconstrictor dose. And what you're really doing that for is to increase blood pressure. All right, this is going to be your hypotensive patients. And that's usually due to sepsis, anaphylaxis, or hypotension refractory to volume replacement, to fluids, okay? So if you need to raise somebody's blood pressure, if despite dumping 2 liters in them in a septic patient, you've still got a blood pressure of 70/50, and you need to get that blood pressure up, it's at an unsafe level, you're going to consider a vasopressor. Dopamine is one of those options. It's on the weaker options, what you have in your bag for vasopressors, but it is an option. And obviously, as you get higher into the dose, you're going to get more squeeze. So 20 mics per kilo per minute is going to have more of a vasoconstrictor effect than 10 mics per kilo per minute. All right, now I promised you all a shortcut to figure out dopamine. All right, so a couple things here. This is the dopamine shortcut, and this is the way that you are going to figure this out at 3 o'clock in the morning and when you don't want to do longhand math. All right, I'm going to preface this with, for testing purposes, you're still going to have to do the entire dopamine calculation from start to finish, but this is the shortcut. This is the shortcut I use when I need to hang dopamine and administer it to a patient, because you typically have so much going on that you don't have the time to sit down and figure this all out. And this is accurate usually within 2 to 3 drops per minute. What you need to make sure of is that you are using standard concentration. And if you remember, standard concentration on dopamine is 1,600 micrograms per ml. And so how's that going to become packaged? That's going to be the 400 milligrams in 250 mLs, or the 800 milligrams in 500 mLs. But what you're definitely looking for is the 1,600 micrograms per ml. And the other thing that you need to make sure that is that you're using 60 drop tubing. All right, so let's talk about how this works. As long as you have those factors, standard concentration, 60 drop tubing, what you do for the dopamine shortcut is you take the patient's weight in pounds, not kilograms, in pounds, okay? So an example is a 180-pound patient, okay? You take that 180, take off the last number, okay? So you've got 18, and then what you do is you subtract 2, okay? So 18 minus 2 is 16. And what does that equal? That equals 16 drops per minute of dopamine, standard concentration, 60 drop tubing. 16 drops per minute is equal to, or around, 5 micrograms, excuse me, not milligrams, micrograms per kilogram per minute. All right, so if I know that 16 drops per minute on this patient is equal to 5 micrograms per kilogram per minute, and I want to provide a vasopressor dose, right? Let's say I want to do 15 micrograms per kilogram per minute. What do I need to do? Well, I need to triple it, right? Because I'm at 5, so I need to go 5 to 10 and then 10 to 15, 5 times 3. And now, how would I figure that out? I would take the 16 drops per minute and I would triple that. 16 times 3, 48 drops per minute. Let's try another one. All right, I have a 230-pound patient, and I want to give 10 micrograms per kilogram per minute. So I'm going to take my 230, I'm going to get rid of the last number, I'm going to subtract 2, and I have 21, and that's 21 drops per minute is equal to 5 micrograms per kilogram per minute. Well, I know I want to get to 10, so I'm going to double it. 21 times 2 is equal to 42 drops per minute will give me 10 micrograms per kilogram per minute. It's accurate within 2 to 3 drops per minute every single time, and something that you should be familiar with. But once again, I want you to be able to figure out exactly the number of drops per minute. So if you have any questions, make sure you submit them through the link on Blackboard or bring them to class. Thank you.